mental health tonight, startling statistics about the first 12 months of motherhood. There are studies that are showing 20% of women worldwide experience a mood or anxiety disorder related to childbirth. 7 out of 10 of those new moms either downplay their symptoms or hide them completely or don't even realize that they're having them. Joining us now for World Maternal Mental Health Day is Dr. Varsha Radhakrishnan. Doctor, thank you for being here, a psychiatrist at Tufts Medical Center. This is an important discussion for so many. A lot of us know that motherhood impacts our schedule and yes, our sleep, but it can also do something really profound to our brain.
It's such an important topic, and I'm so glad to be here to discuss this. So during pregnancy and after delivering a baby, you can see such a large change in hormones like estrogen, progesterone, changes in the way our brain functions and connects. All of this helps with bonding with the baby, with creating that heightened sense of emotional sensitivity. But on the other hand, all of our brains react and adapt differently. And so what might be one experience for one mother could be different for another. So this can make women more vulnerable to stress, anxiety, depression, and so on.
Which makes it really difficult to recover after the childbirth mentally. So do research, and you're so thrilled that you have this baby, but then it's confusing because you're not really quite sure why you're feeling these certain ways, which is why this research is so important. Why are so many women reluctant to share their symptoms, do you think?
Yeah, culture and societal expectations of being a good mother often center around this sense and belief that motherhood should be self-sacrificing, always nurturing. Women should be able to handle any challenge without complaint or visible struggle, even when things get really difficult, and especially when it comes to caring for their babies. So many women may actually hesitate to share their symptoms due to fear of being judged or feeling inadequate in those settings.
And the best thing they can do is sharing that information, correct?
Exactly. Sharing it is the most important.
It is. What's your advice for their partner or other friends and family members if they see something or if they recognize some of those symptoms? Because sometimes these mothers are so tired they don't even realize what's happening.
Absolutely. The most important thing for loved ones is to always take a look and see, is my loved one feeling more persistently depressed or sad? Are they more tearful than usual? Are they having trouble sleeping the same way that they usually might? Trouble bonding with the baby? So small things like, increased isolation, those are all warning signs and symptoms. And especially when things get more concerning, it's important to always notify a mental health and medical provider as soon as possible.
So if you're in that situation and then you recognize it, do you say it to the person, to the mother, or do you go and contact a doctor?
So in that case, always bring it up to the mother first. I think it's very important to have that sense of agency and control as well, and decision making. And I think it helps to show as well that you're supportive as a family member and there for your loved one.
Yeah, it can make all the difference. Dr. Radhakrishnan, thank you so much. Important topic, and we appreciate you.